Phenylketonuria, or PKU, is a condition that around 25 children are born with in Australia every year. Because PKU patients lack an enzyme required to break down the amino acid phenylalanine, when they eat protein, harmful levels can build up in the brain. This can cause irreversible brain damage in childhood, and moodiness, irritability, trouble focusing, anxiety and depression throughout life. Because phenylalanine is found in the majority of everyday foods, PKU patients have to dramatically restrict what they eat in order to avoid brain toxicity.
PKU is a very serious condition. Having been off diet when I was 10 for a few years and sort of off and on for a while, I know I did do damage to my brain, and long term that can still be the case.
I've got 3 boys, 2 of them have PKU, so it was quite frightening as parents to not know what that future is going to be like for your child.
If it's not treated, you would be brain damaged, severely brain damaged.
The low-protein diet required to avoid brain damage is incredibly strict and difficult to adhere to for life.
It's hard. I'll be honest, being on my diet for PKU, I struggle every day.
I would say I make compromises.
We're very diligent with their diets, and that means weighing their food and calculating the amount of protein in that food to 0.1 of a gram.
But diet alone is often not enough to keep phenylalanine levels low enough to be safe.
I think it is hard. There's some times where you don't understand why your level is out of range. When my levels do rise, I feel lethargic. I feel a little bit moody, so a little bit cranky at times, and also my ability to focus. I participated as a volunteer in a study of the brain, which included an MRI, and I was actually called into an office to speak to a doctor because it was found that I had white brain matter changes in that MRI. And that's even though I'm really strict on my diet. So that's quite scary that dietary therapy and sticking to it and following all the guidelines still results in a suboptimal outcome.
There are now medications that can help reduce phenylalanine, making it easier to maintain safe levels.
Josh and Tom both recently started a medication that lowers their blood phenylalanine levels, and they've been on that for about 3 months now. Overall, being on the medication has been a big change for the boys.
It's a lot easier to go to mates' houses because I'll just get something that I probably wouldn't have been able to have before, like a gluten-free pizza from any pizza shop.
I just get to eat a bit more normal food like that other people would eat, and I'm kind of like feeling a bit more fitting in, I guess.
But in Australia, the current medication is only available to patients under 18 years.
It is a bit of a kick in the guts that there is something that would change my life and my ability to, I'd say, live a better quality of life as well. It's been available to the rest of the world for so long, decades. It's a bit sad that Australia's lagging behind.
I find that quite unfair, like unjust, almost discrimination. It'd make a huge difference to my life if I was able to take some sort of drug therapy.
There's other conditions, to my knowledge, like type 2 diabetes that can be treated by dietary therapy, yet there's medications available to those people, and I'm not sure why PKU is any different.
Hopefully, sometime soon, current medications and even more effective treatments will be made available to PKU patients of all ages.
I hope that the Australian government will allow more medications to be available to patients with PKU. There's a lot happening and a lot in development at the moment, which is really exciting.
I'd like to hope that, in my lifetime I'll see some access to more effective treatments that work for everyone, and that there's something accessible for everyone, regardless of your age or stage of life.
I hope that one day they are able to access even better treatments and possibly even a cure that means that they don't need to worry about this anymore.